More and more older Americans are aging in place, but many will look for ways to stay social and active. One option that could help: Senior Day Service Centers. According to the National Center for Health Statistics 2022 data, there are more than 3,000 Senior Day Service Centers in the U.S., serving roughly 200,000 participants. Ray, what services do these centers provide, and when should families consider a day service center for a loved one?
I think it's a great concept. This concept of adults being able to go somewhere that's actually supervised, staffed, and it allows the caregiver to get some rest. And a lot of the actual seniors, I know some, they look so forward to it. Like when the buses can't run because there's snow or the rain, they're really upset. I think that's their excitement. They get out, caregiver gets rest, they get excitement, they're getting away also. They get routine, they get activities. It depends on what kind of facility you're going to, but I think people can look and see if it's something that they need for their patient or their loved one.
And I think, yes, you keep saying the caregiver gets to get rest, and that would be great, but sometimes they just get to go to work. If you're caring for an aging loved one and the question of safety comes into play, or just socialization even, and you're still having to work, home care is expensive. And this is the alternative to bringing in caregivers into the home is, can we take mom or dad or grandma or grandpa, whoever's in need, can we take them to this place where they get socialization, they get good food, they have monitoring. Some of them are, heavy on the social activities, and then some are actually more heavy on the care, depending on the organization. And then you can go to work with the peace of mind of, I'm not going to get 20 phone calls. I'm not worried about whether the house is burning down. I'm not worried about whether or not maybe you walked out, if there's a little bit of memory stuff going on. So there's some really good aspects for the caregiver. And that, even if you're at work, that peace of mind is a respite.
Kind of like the same concept of your children going to school. Yeah. They go to school, you go to work.
Yeah, and the peace of mind that you get knowing that they're taken care of.
Mm-hmm. I think, too, you can do a 4-hour shift, you can do an 8-hour shift. Some of them provide transportation. They'll pick them up, bring them home. And then, like you said, the cost of home care, kind of blending this concept with home care can extend the amount of time that you can stay at home. And it's interesting to me how different organizations do the day center concept. Religious organizations, churches sponsor daycare programs. Assisted living communities, they will oftentimes have a daycare program. I remember years ago, I worked in a nursing home, and the administrator established a daycare within the nursing home. So I think it would be important to look at your local area and see who's doing these day center programs.
And some of them are covered under your Medicare Advantage plan. So check with that and see. A lot of the Medicare Advantage, they offer these programs, and they're incredibly well run.
They're really quite something to go visit. So it allows you to run your household, maybe do your workouts, do the things that you need to do while your loved one is having, hopefully, a good day.
Any suggestions on how to choose?
Looking at who you're needing the care for, like Sam said earlier, if it's a heavy medical need, look for a day program that has heavy medical. And then in terms of the cost, some programs offer sliding scales where they'll bring the cost of the day program down, and some states offer Medicaid waiver programs that will help pay for that care. So look at the need, and then look at what your budget is, and look at what's more affordable for you.
And you can save some of those pennies for the bank for later when the care needs are more.
Absolutely. So really great option. And we're all about solutions here on Aging Untold, and we've got more coming. Stay with us.